Every dog owner knows that no matter how healthy their dog has been, there will come a time when they will have to part ways. It's a difficult reality, filled with decisions about when and how to intervene. But most importantly, we need to understand what our dog is going through. There are subtle signs that dogs show when they are entering the final stages of their lives. Farewell signals that, if recognized in time, can help them feel comfortable and leave in love. Today, we'll look at 14 important signs that a dog is approaching the end of its life. If you find this video useful, don't forget to like and subscribe to the channel so you don't miss out on meaningful content about the dog world. Loss of interest. One of the earliest and most noticeable signs is a change in your dog's attitude and behavior. A dog that was once full of energy and eager for everything becomes lethargic, apathetic, and loses its natural curiosity. They no longer show interest in favorite toys, fun walks, or even delicious treats that they used to look forward to. They may become less social, withdraw from family members, and spend most of their time alone. This loss of interest can be a sign of a number of underlying problems, including pain, fatigue, cognitive decline, like Alzheimer's disease in dogs, or simply a change in needs and interests due to age. Lethargy. Along with loss of interest comes persistent fatigue and a significant decrease in physical activity levels. The dog sleeps more than usual, often feeling lethargic and lacking in energy. Even simple activities such as walking around the house, climbing stairs, or taking a light walk become difficult and exhausting. They may spend most of their time lying down, with little movement, and are prone to pressure ulcers if not cared for properly. This lethargy can be caused by decreased heart and lung function, joint problems such as arthritis, neurological problems, or simply the gradual decline of the body due to aging. It is important to closely monitor your dog's activity level and consult with your veterinarian to determine the cause and appropriate intervention. Decreased appetite. Declining health in older dogs is often accompanied by changes in taste and appetite. Your dog may become more picky, preferring only certain foods, or even skip meals altogether. This can be due to a variety of factors, including pain, especially dental problems such as gingivitis, cavities, or tooth loss, decreased senses like smell and taste, making food less appealing, difficulty chewing and swallowing, medication side effects, or other underlying medical conditions. During this time, it is important to ensure your dog is getting adequate nutrition. You may need to experiment with different foods to find one that your dog will eat, focusing on foods that are soft, easy to digest, flavorful, and nutritious. In some cases, hand feeding or using a syringe may be necessary to ensure your dog gets the calories and nutrients they need. Reduced water intake. Another important sign to look out for is a decrease in your dog's daily water intake. As we age, kidney and brain function can decline, affecting the ability to regulate fluid balance in the body. This can lead to dehydration, especially in hot weather or when your dog is exercising a lot. Not only is lack of water uncomfortable, it can also aggravate other health problems, causing constipation, thickening the blood, and affecting the function of vital organs. To ensure your dog is getting enough water, we can encourage them to drink more frequently by placing multiple bowls of clean water in easily accessible locations, using automatic waterers, or even adding water with a syringe or mixing water into moist food. Severe weight loss, muscle atrophy. A general decline in health can lead to severe weight loss and muscle atrophy, especially in dogs with chronic illnesses or eating difficulties. We may notice a loss of muscle mass, making the dog look thin, weak, and bony. This condition not only affects appearance, but also has serious health consequences, including dehydration, impaired organ function, reduced mobility, and increased risk of infections. To prevent weight loss and muscle atrophy, It is important to ensure that the dog is provided with a high-quality protein diet that is easy to digest and meets calorie needs. We can consult with our veterinarian to choose the right food and supplement the necessary nutrients. Mobility problems. As dogs age, they may experience mobility problems that make them clumsy, have difficulty moving, and are prone to falls. They may lose coordination, stagger, have tremors, have difficulty standing up or sitting down, or even become partially paralyzed. These problems can have many different causes, including arthritis, which causes pain and stiffness in the joints, neurological problems, such as spinal degeneration, decreased muscle function due to aging or disease, or other underlying conditions. Mobility problems can severely impact a dog's quality of life, making them dependent on others for assistance with daily activities and increasing their risk of injury from falls. It is important to see your veterinarian to determine the cause and get appropriate treatment. Loss of bladder and bowel control. Loss of bladder and bowel control is a common problem in older dogs, causing a lot of frustration and difficulty for both dogs and owners. Weakening of the bladder and anal muscles, combined with neurological problems or other underlying medical conditions, can cause dogs to lose control of their bladder and bowel movements, leading to incontinence, urinary incontinence, fecal incontinence, or even chronic constipation. This condition is not only unhygienic and increases the risk of infection, but can also make dogs feel embarrassed, stressed, and anxious. To help your dog feel more comfortable, you need to clean them regularly. Use absorbent diapers or pads to keep them dry and clean, and consult your veterinarian to find the root cause and get appropriate treatment, such as medication or muscle-strengthening exercises. Seizures. Seizures are a worrying sign, indicating an abnormality in the electrical activity of the brain. In older dogs, seizures can be caused by a variety of things, including kidney failure, liver failure, brain tumors, neurological conditions, or even side effects of certain medications. Seizures can manifest in a variety of ways, from mild jerking of one part of the body to severe generalized stiffness, loss of consciousness, and foaming at the mouth. If you notice any signs of seizures in your dog, take them to the vet immediately for prompt diagnosis and treatment. Controlling seizures can improve your dog's quality of life and prevent dangerous complications. Changes in breathing rate. Breathing rate is an important indicator of your dog's health. Abnormal changes in breathing rate, such as rapid breathing, open mouth breathing, wheezing, shallow breathing, labored breathing, or irregular breathing, can be signs of serious problems with the heart, lungs, or other organs. For example, rapid breathing and open mouth breathing can be a sign of heart disease, lung failure, pleural effusion, or airway obstruction. Wheezing can be a sign of bronchitis or asthma. Shallow and labored breathing can be a sign of respiratory distress or neurological problems. If you notice any unusual changes in your dog's breathing rate, take them to the vet immediately for examination, diagnosis, and treatment. Early intervention can significantly improve your dog's health and extend their life. Decreased ability to regulate body temperature. Older dogs may have difficulty maintaining a stable body temperature, especially in extreme weather conditions. They may be more susceptible to cold in the winter and more susceptible to heat in the summer. You may notice that their paws and mouths are colder than usual, or that they may shiver or pant as they try to regulate their body temperature. To help your dog feel more comfortable, make sure they have a warm place to sleep in the winter and a cool place to rest in the summer. You can also use a dog coat in the winter and provide them with plenty of water in the summer. Pain and discomfort. Pain is a common problem in older dogs, often due to joint, spinal, or dental problems. Your dog may not show obvious signs of pain, but you may notice signs such as whining, reacting to touch in sensitive areas, moving slowly or awkwardly, or being more irritable than usual. If you suspect your dog is in pain, take them to your veterinarian for diagnosis and treatment. Behavioral changes. Changes in behavior are an important sign that your dog may be experiencing health problems. Your dog may become more avoidant or clingy than usual, may become restless, anxious, irritable, or even aggressive. These changes may be due to pain, cognitive decline, loss of vision or hearing, or neurological problems. If you notice any unusual changes in your dog's behavior, take them to your veterinarian for an examination and advice. Changes in gum color. Gum color is an important indicator that can provide valuable information about your dog's overall health. Healthy gums are usually pale pink. Any change from this normal color can be a sign of an underlying health problem and should be checked by a veterinarian. Pale or white gums can be a sign of anemia due to blood loss, lack of blood cell production, or other diseases. Shock due to dehydration, infection, or other causes, or heart problems. Blue or cyanotic gums often indicate a lack of oxygen in the blood, which can be caused by respiratory, heart, or poisoning problems. Yellow gums, also known as jaundice, can be a sign of liver disease, gallbladder disease, or problems that destroy blood cells. If you notice any unusual changes in gum color, take your dog to the vet immediately for timely diagnosis and treatment. Persistent vomiting or diarrhea. Vomiting and diarrhea are common gastrointestinal symptoms in dogs and can sometimes resolve on their own without medical intervention. However, if vomiting or diarrhea lasts longer than 24 hours or is accompanied by other serious symptoms such as dehydration, lethargy, abdominal pain, or blood in the stool or vomit, it may be a sign of a more serious health problem and should be evaluated by a veterinarian. Persistent vomiting and diarrhea can lead to severe dehydration, disrupt electrolyte balance, cause malnutrition, and affect the function of vital organs. Possible causes include infection, bacterial, viral, or parasitic, food poisoning, food allergies, pancreatitis, inflammatory bowel disease, IBD, or even cancer. Your veterinarian will conduct the necessary tests to determine the cause and prescribe appropriate treatment, including rehydration, antibiotic treatment, if necessary, and dietary adjustments. Recognizing these signs not only helps us prepare mentally, but also ensures that our dogs are cared for with love and respect in their final days. Although saying goodbye is heartbreaking, it is our care and understanding that will help them pass away peacefully. Thank you for watching the video until the end. If you find this content useful, please like and subscribe to the channel to continue accompanying us in meaningful videos about the dog world. See you in the next video.